The American College of Preventive Medicine funded the Emory University School of Medicine and the Emory Healthcare Network as an integrated healthcare delivery system to improve referrals to the diabetes prevention program services that are available in the Atlanta region, which is where Emory is located. I think the thing that was the most valuable for us was working with the community. The major service provider was the YMCA of Metro Atlanta. And because of the way our patient population, where their residences are located is throughout the Atlanta region, the Y had services in 16 different sites throughout the Atlanta area. So it was fairly easy to align people into their community, get them services in their community. We started in the lifestyle clinic, which is part of the services that are provided in the overall family medicine clinic. So we just reached out to them with mailings, brochure, and then contacted them by phone to see if they would be interested in participating in the program activities. We were actually very gratified by the response patients had to our outreach. At every stage, when we could actually contact people, because we contacted them by phone generally, at least 2/3 of the people were very interested and willing to go to the next step to be engaged in the program. We used two different tools as means of engagement. One was a brochure from the YMCA. We mailed those to all the potential participants. The other was by calling them on the phone, and it was the interpersonal connection that really got people interested. You know, the key to this was that these were people we were already involved with in our lifestyle clinic. They already had a relationship with the clinicians. They knew many of the staff in our clinic. So when we reached out to them, they were familiar with us. And as we described what we were offering them in terms of these services, they were very responsive. One of our big surprises was, in total, we were only able to get little less than 50% of the people to answer the phone. I was after even trying to contact them 3 times. So I think one of the things we're going to need to think about is other ways to connect with people, sort of getting back to their providers and see if we can get them involved in this through their interactions with their providers. So that was a surprise and a challenge, that we couldn't even get people to answer the phone. I think the telephone is becoming less and less of a way to connect with people nowadays. The other big challenge, during the time we at least initiated this project, most of our patients did not have insurance that would cover the cost. And the number one reason we got back when we were able to contact people for having a lack of interest is when they heard it was going to cost them a little bit north of $400 to participate in this. That was a barrier for them. So that's a challenge we'll need to work on to overcome. I think the major lessons learned is that, one is that having a strong community partner is critical. One of the things as a provider ourselves is we have a tendency, as most doctors and healthcare providers do, to try to do it all yourself. And making connections with community providers and community resources was a big lesson for us, and it was a big help in terms of being able to recruit people into this program.